Hi, I'm Molly, and I want to thank the ICS for allowing me to speak today about mobile health applications related to pelvic organ prolapse and stress urinary incontinence. I have no affiliations to disclose today. As technology is becoming increasingly integrated in healthcare in terms of use by both physicians and patients, it becomes even more important to evaluate accessible mobile phone applications that patients use for credibility, accuracy, and utility. We aimed to evaluate apps using Xcertia guidelines for app operability, privacy, security, content, and usability, and we also analyzed app usage. Mobile health apps were found on the Apple App Store or Google Play Store with keywords pelvic organ prolapse, incontinence, or bladder. Exclusion criteria include apps that were not free, were not updated in the past year, not in English, or required to purchase product for use. The number of ratings and reviews on the app stores were collected for each app, and a sentiment analysis of reviews was conducted. A positive review contained only positive feedback, a negative review contained only negative feedback, and a neutral review contained both positive and negative feedback. Apps were then evaluated along the Xcertia guidelines with categories including app operability, privacy, security, content, and usability. In total, 7 Apple apps and 21 Google apps were included. For the Apple apps, there was an average of 143.7 ratings and 4.56 stars. There was an average of 142.6 reviews with majority positive reviews. For the Google apps, there was an average of 2,968 ratings and 4.21 stars. There was also an average of 216 reviews with also majority positive reviews. For both sources, the highest rated apps are also amongst the most used. For operability, only 4 out of 7 Apple apps had developer contact information, whereas all of the Google Play apps did. Of the Apple apps, 4 out of 7 had an informational component, and only 2 out of 7 clearly showed the sources. For Google apps, 15 out of 21 had an informational component, but only 3 out of 21 had provided sources. All apps met the guidelines for privacy, security, and usability. Most apps were well received by users based on ratings and reviews. However, sentiment analysis of app reviews must be considered with the total number of reviews for each app. While some apps had hundreds of reviews, other apps had very few, as low as 1 in some cases. Making sure that the most popular apps are also the ones with the best content is important when considering that new users are more inclined to try apps that are positively reviewed and highly rated. The importance of mobile health apps following Xcertia guidelines increases as patients' use of mobile-based technology is increasing. Apps have little oversight or regulation, with the possibility of inaccurate and unreliable information being passed on to users. Although most apps met the functional guidelines of Xcertia, the quality of content in our analysis was variable. Some apps do not have any informational component and were simply instructional without explanation. Very few clearly listed their sources, which brings the credibility of some apps into question and leaves us unable to verify the information provided. Providers considering recommendation of well-rounded health apps to patients should consider those that meet the Xcertia guidelines, have an educational component, and list their sources. For future studies, evaluation of the quality of apps on other platforms is encouraged. Thank you for your attention today.